Today we are going to be going over two chapters, chapter 2 and chapter 3. Normally we allow one chapter per hour is how we tend to break things up. So depending on how much information there is, it could be a little bit over or a little bit under. But today we are continuing our talk on how to read the map. Our discussion at the beginning of the book is very broad. We have to know what we're talking about and the landmarks that we're talking about. So we talked about the oral cavity last week, and today we're going to be talking about the tooth, function, and terms. Now this will be a review for many of you, but we have some novices in the class, and so we take everything back to the beginning so we're all using the same language, because it does get to be important in certain times. So let's talk about the planes of the head. The planes of the head. So anything going up is superior. Anything going down towards your toes is inferior. Now we're just talking about the head, all right, because we are in oral anatomy. So superior is above, inferior is below, and then we have the sides, which are lateral. Okay, the sides are the lateral, so it's either the right lateral or the left lateral. Okay, they are going out to the sides where your arms are. Then you have medial, which is coming into the midline where your nose and chin and lips are. That's the midline. Then you have anterior, which is towards your nose or the facial direction towards the front of you, and posterior, which is towards the back of you. So you need to know the terms superior, inferior, anterior, posterior, lateral, and medial. When we're talking anatomy, this is going to be critical, so we're all looking and visualizing the same structure. And this is oral anatomy, which is more succinct than head and neck anatomy. So we're going to be talking about teeth for many, many weeks. And what is the function of teeth? Well, teeth are essential for protecting the oral cavity, acquiring and chewing food. So acquiring food is actually biting into, like the apple, and then chewing the apple. Aiding in the digestive system and breaking down food, because when you're chewing, the saliva is being mixed with the food. You're making a bolus, so you can then have things mashable and swallowed. And it also, the teeth aid in communication, functioning in communication. It's allowing us to place our tongue on certain areas of our mouth so we can form sound. So we've got the teeth, we know what the function of the teeth are, and then the teeth are divided into parts. Each tooth has a crown and a root portion, and the crown portion is covered with enamel, and the root portion is covered with cementum. Okay, and the crown and the root are joined at the cemento-enamel junction. Everything's going to have a junction, just like your mucogingival junction. With your mucosa, the crown and the root have a CEJ, we call it, or the cemento-enamel junction, where the enamel stops and the cementum begins. The line is formed by the junction of the cementum and the enamel. That line is called the cervical line. Okay, the CEJ also forms the cervical line. So we've got our cementum and our enamel. They join at the cemento-enamel junction. And when we're talking cervical area of the tooth, it's anywhere around that CEJ is the cervical area. So the crown portion of the tooth erupts through the bone and the gum tissue and continues to erupt until all the crown is exposed. So picture A is a tooth that is unerupted. Picture B, okay, in the center, You have the cusp tip or the incisal tip peeking out. And then picture C is when the tooth is fully erupted. You've got the crown, the enamel portion of the tooth, and the root, the cementum portion of the tooth. Now we're going to break that down even further to confuse you. The anatomic crown is the whole crown of the tooth that's covered by enamel, whether it's erupted or not. So if it's covered by enamel, it is the anatomic crown. But the clinical crown is that part that is seen above the gingiva. So I'm going to take this back here. All right, so we've got an anatomic crown that is any part of the crown that's covered with enamel, but only the part that's exposed is the clinical crown. So on picture B, the clinical crown is just this tip, the incisal tip. On picture C, the clinical crown is what you see clinically versus what is anatomically present. Are we good with that so far? Clinical crown versus anatomic crown. Now this is where it even gets more confusing because this textbook calls the clinical crown any part seen above the gingiva, and Wilkins calls it it defines it a little bit differently. So there is some confusion, which we will get into, okay? So the tooth can have, let's talk about the roots, a single root or multi-root. If it has two roots, the roots are separated by what we call a bifurcation, B-I meaning two. A bifurcation. If it has three roots, 1, 2, 3, it's called a trifurcation. Bi for 2, tri for 3. Each root has one apex or terminal end. The root is supported in the dental arch by the bony process of the jaw. The portion of the jaw that supports the teeth is called the alveolar process, and that's what you're seeing radiographically. You're seeing the alveolar process. The bony socket in which the tooth fits is called the alveolus. So the alveolus is the socket. The alveolar process is the bone. The teeth in the upper part of the jaw are called the maxillary teeth because they are anchored in the maxillary bone. The teeth in the lower jaw are called the mandibular teeth because they are anchored in the bone called the mandible. Now, some offices you go in, you could use the term upper, you could use the term lower with the doctor. I was with one periodontist early on, and we had to use the clinical terms, and I was corrected that no, it's not an upper left canine, it's the maxillary left canine. It's like, well, excuse me. So you need to just pay attention to what language your particular offices use, and it's all accurate. Upper left, UL, for upper left versus ML, is that maxillary left or mandibular left? So when we're using our abbreviations with our clinical notes, we're using upper and lower. So what are the tissues of the teeth? You have 4 tissues. You've got the enamel. Remember that clinical crown or anatomic crown. You've got your cementum. And then inside the tooth, you have something called dentin and the dental pulp. So the first 3 are going to be hard tissues. Okay, so you've got enamel, dentin, and cementum are considered hard tissue, but the pulp is considered soft tissue. Now remember, you've got the socket that the tooth fits in. That's called the alveolus. which is the tooth is housed within the alveolar process. So let's talk about the enamel. The enamel forms the outer surface of the crown, and it's the thickest over the tip of the crown and becomes thinner until it ends at that cervical line, that cemento cervical, cemento enamel junction. The color of the enamel varies with its thickness and mineralization. The thicker the enamel, the whiter it appears. The thinner the enamel, the more the color varies, because the enamel, where it's thin, can be translucent, and you're seeing the dentin underlying that. So the enamel forms the outer surface of the crown. It's thickest at the crown of the tooth and thinnest at that CEJ. And think about, where are you putting your instruments? If you're scaling, trying to clean somebody's teeth that has calculus along the gum line area, you're scaling at that CEJ area, that cervical line where the enamel and the cementum join, and it's very thin. So sensitivity can ensue. So some people will be very sensitive to scaling. So the more mineralized the enamel, the more it lends itself to translucency. These two factors, the mineralization and the thickness of the enamel, determine the color of the enamel. So everybody's got different color of teeth. Some are going to be whiter than others. Some will be yellower. Some will be grayer tinged, depending on the thickness of the enamel and the underlying structures. Now on TV, you're seeing everybody with very, very white, unnaturally white teeth. And that in America has become the norm for what we are aspiring to with what we consider normal. Well, all enamel has a yellow pigment to it. So they're not supposed to be white, but we're making them that way. Enamel is the most densely mineralized and hardest tissue of the human body. It's the hardest tissue of the human body. It is harder than bone. This is always on a test. It's always on a board question. If you end up with that, that's one of those, what's the hardest substance of the body? It's going to be the enamel. So think about how hard that is and how much acid has to be produced to form a cavity. So you need to know the chemical composition of the tooth parts as well. The chemical composition for enamel is 96% inorganic and 4% organic matter and water. So it's very hard. The dense mineralization gives the enamel the ability to resist the wear of the crown of the tooth, okay, because that's what we're using to break up the food. Then underlying the enamel is the dentin, and that forms the main portion of the tooth, makes up the bulk of the tooth, the dentin. In the crown area, it's covered with the enamel, and in the root section, it's covered with cementum. The dentin is hard, it's dense, and it's considered a calcified tissue. Yet, it's less calcified than the enamel. Now, we're using the term calcified instead of harder. Okay, and that's the same thing. The dentin is less calcified. It's not as hard as the enamel portion of the tooth because it's less calcified. It's yellow in color, and it has a little bit of elasticity in nature. It's got a little bit of a give to it. But take a look at the chemical composition. Enamel was 96% inorganic. Dentin is 70% inorganic with 30% organic material and water. Now we're trying to get to 100% here. So it's 70-30. Enamel was 96-4. Dentin is 70-30. Unlike the enamel, though, the dentin is capable of adding to itself. It can repair itself. And when it adds to itself, it's called secondary dentin. Okay, you weren't born with it, but it's replenishing itself. Secondary dentin is formed throughout the pulp chamber, which we're going to get into what the pulp is, because that's the soft tissue, after the tooth erupts. Now that's secondary dentin versus reparative dentin is the dentin that's laid down in response to caries, which is cavity process, or trauma. So secondary dentin is a natural function of what the dentin does. It repairs itself and it adds to itself. But if there's trauma or caries, it's called reparative dentin, which is really secondary dentin. It's just in response to something else. Then we've got the root covering, and that's the cementum, which is a bone-like substance that covers the root of the tooth. The main function of cementum is to provide a medium or a vehicle for the attachment of the tooth to the alveolar bone, because the tooth just isn't stuck into that alveolar process. It needs something to connect it. All right, so it's not as dense or as hard or as calcified as the enamel or the dentin, but it is more dense than bone. The chemical composition, okay, let me go over this and then I'll stop. Okay, the chemical composition, we're going down from the hardest substance of the body, which was the enamel. Then we have the dentin. Right now we've got the chemical composition of the cementum, which is 45 to 50% inorganic, and then 50 to 55% organic components, making it less durable than the dentin or the enamel. Okay, what was the question?
Sorry, I'm just looking through the book as you're talking and everything, and noticed you had said that the secondary dentin is reparative dentin. In the book it says tertiary dentin. Which one?
I'm not going to ask you about tertiary dentin.
Okay, so it says that that's often called reparative dentin. So we should know that it's secondary dentin.
So, yeah, they're classifying it differently.
Okay, that's good to know.
That's all. You've got secondary dentin, reparative dentin. Those are the two that you need to know. Now, if we were in dental school, it would be a different thing.
Okay, so we should know that secondary dentin is also reparative dentin.
It's also reparative dentin.
Okay, good. Thank you so much.
But it's in a response to, it's repairing damage, versus secondary dentin is just the natural phenomenon.
Okay, great. Thank you.
Mm-hmm. Cementum is thin, and it's thinnest at the cervical line. Where was enamel the thinnest? At the cervical line. Okay, so it increases slightly in thickness towards the tip or apex of the root. Now, the union of the cementum and the dentin, where they meet, is called the dentino-cemental junction. So if you know the parts of the tooth, you can pick the word apart even though you've never heard it before. Dentino is the dentin, cemental, cementum, junction. Okay?
Miss D.
Yeah.
The chat box, it says more dense than bone means cementum is still hard than bone.
That's what the book is saying. But it's still harder than bone, but enamel is the hardest substance of the body, then cementum, and then bone. But cementum is so thin, that's the problem. You don't have a lot of it. So there's two types of cementum, because just like dentin, we can't make it easy. You have cellular cementum and acellular cementum. So the cellular cementum is actually the cementum that's confined to the apical third of the root and can reproduce itself. Okay, so the apical third of the root, the tip third of the root, has cellular cementum. The rest of the cementum is acellular. It can't repair itself very easily, okay? And it covers the entire anatomic root. The cells that produce cementum are called cementoblast. B-L-A-S-T is the forming cells. Clast, C-L-A-S-T, are the cells that take away. Blasts and clasts. Cementum gives the tooth a mechanism of anchorage. So nutrition for the cementum is really derived from the outside of the tooth through blood vessels that come directly from the bone. So the bone is feeding it. So the most inner portion of the tooth is called the pulp. That is considered soft tissue. The dental pulp is composed of blood vessels, lymph vessels, connective tissue, nerve tissue, and then those special dentin forming cells called odontoblasts. Odontoblasts are dentin forming cells. So that's where all the activity is taking place, is within the pulp. The pulp is housed in the center of the tooth with dentin surrounding the pulp chamber, and outside of the dentin, you then have your enamel and you have your cementum. The pulp is considered soft tissue. So blood vessels bring the nourishment that's necessary to activate the support of the formation of secondary dentin. You not only have blood vessels, but they also, for secondary dentin, but they also supply the white blood cells. Remember, we said that lymph tissue is inside the pulp, and white blood cells are necessary to fight bacterial invasion within the pulp because you've got blood circulating there. The lymph tissue filters the fluid within the tooth, and the nerve tissue is a sensory in function and responds to pain. The nerve tissue is what the tooth is experiencing. When you feel something hot, you feel something cold, that's the nerve tissue. The only thing it responds to is pain. The only thing. Anatomically, the pulp is divided into two areas. You've got your pulp chamber and then your pulp canals. So the pulp chamber is housed within the coronal portion of the tooth. So the enamel portion of the tooth, the part that's sticking up above the gum line area, is the coronal portion towards the crown. The pulp canals, or the root canals, are located within the roots of the tooth, or where the cementum is covering. So together, the pulp chamber and the pulp canals are referred to as the pulp cavity. So the chambers excuse me, are the upper part, the coronal part, and the pulp canals are the root part, or the apical parts. The pulp cavity runs the entire length of the interior of the tooth, from the tip of the pulp horns up in the crown to the apex of the root canal. Parts is parts. That's from a It's from a commercial back in the 70s. Parts is parts for chicken nuggets. Got to know your parts. Then we've got the types of teeth. Okay, we looked at the individual parts of the teeth. Now let's look at the types of the teeth. Now, they function depending on where they're located. The function will vary. And the size and shape of the tooth, as well as the location of their jaw, will determine what their function is. So there's three basic food processing functions of the teeth. We cut, we hold or grasp, and we grind. Cut, hold or grasp, and grind. And each tooth is going to have a different function. So we have the incisors. These are your front four teeth. Top and bottom, maxillary and mandibular. The incisors are designed to cut. They have a biting edge that's called an incisal edge, because this biting edge, okay, it's an incisor, and this is the incisal edge, designed to cut. Think about trying to eat an apple. On the tongue surface, the lingual surface of the tooth, okay, it's shaped like a shovel to aid in the food, guiding the food in the mouth. So this is the shovel here. For a mandibular and for a maxillary, guides the food in the mouth. Then we have our canines. The canines are designed to function as holding or grasping the food, okay? They're holding or grasping. They protect the jaw during side jaw movement. So if you take your mandible, your lower jaw, and take it over to the side, one side and then the other, that's called lateral movement. And then when you've got canine to canine, you've got those incisal edges, canine to canine, those should be the only teeth touching. And that's what it means when it protects the jaw joint. The canines are the longest teeth in the human dentition and are the most stable because they have the longest roots. Usually a test question, my friends. The canines are the longest teeth and are the most stable because they have the longest roots. So before implants, we would do anything to try and save a patient's canines because those were the anchor teeth. The dentist could fabricate partials, removable appliances, or fixed appliances to canines because they are the cornerstone of the mouth, okay? They hold, they grasp, they are the longest teeth. Maxillary canines have the longest roots of any teeth. The canine roots are triangular in shape. It makes it possible for the canine to hold its place in the corner of the mouth. Shape and function. Behind the canines, you have premolars. We used to call them bicuspids. We do not call them bicuspids anymore. Okay, they are, you have 4 maxillary and 4 mandibular premolars. Premolars usually have 2 cusps, which is why they were called bicuspids, but some premolars have 3 cusps. So they're no longer called bicuspid because some people will have 3 cusped premolars. So a premolar is the accurate term because if you have 3 cusps, it's not a bicuspid, it's a tricuspid. So we're calling them premolars. Premolars are pointed, have pointed cusps to hold the food. They're kind of a transition from the anterior teeth, the canine, to the posterior teeth, the more flat teeth for grinding. So they hold the food while the lingual cusps grind it, making their function similar to the molars. So that buccal portion, this portion, okay, function to hold like a canine versus the lingual portion grinds, functions as a molar. So it is the transitional tooth. Behind the premolars, you have the molars. And the molars are much larger than the premolars, and they usually have 4 or more cusps. The number of cusps is dependent on the location in the mouth, and there is normal variations of everything, just to complicate things. So your maxillary and mandibular molars, the upper molars and lower molars, okay, we're going to call them maxillary and mandibular, differ from each other in shape, size, the number of cusps, as well as the number of roots. And the function of the 12 molars, you've got a total of 12, 3 on the maxillary right, 3 on the maxillary left, 3 on the mandibular left, and 3 on the mandibular right. The function is to chew or grind. So the takeaway from these chapters, my friends, is to know what the form and function is. We are going to have a whole chapter on each of these class types. So how many cusps? Okay, they can have 4 or more cusps. There can be 4 or 5 cusps on the occlusal surface of a molar. Now this is a mandibular molar, I know, because it's got 2 roots. So it's got a bifurcation. The maxillary molars have 3 roots. I know, as you will know in a couple of weeks, that this is a mandibular first molar. You're also going to be able to know whether it's the mandibular right or the mandibular left. This is the mesial portion of the tooth. So you've got 1 cusp, 2 cusps, okay? Then you've got this distal cusp here. So this is the buccal, and then you've got the lingual. So we are going to, when we're looking at molars, for example, we are going to be taking this one tooth apart and learning about each of its parts. Now, how's that for a tantalizing image of what's to come? So we looked at all the different tooth types. So the incisors and the canines are called the anterior teeth because they occupy the anterior or front of the dental arch. The anterior teeth have 4 surfaces and a ridge. Okay, so the anterior teeth are your 4 incisors, top and bottom, and your 2 canines. Then you've got your premolars and your molars that occupy the back portion of the arch, and they're called your posterior teeth. And the posterior teeth have 5 surfaces because they have an occlusal surface, a biting surface that the anterior don't have. The anterior teeth has a ridge versus the posterior teeth have an occlusal surface. More landmarks. If the surface of the tooth faces the tongue towards the inside of the mouth, it's called the lingual surface, the inside of the mouth. Whether it's a top tooth or a bottom tooth, a maxillary or a mandibular tooth, we call it lingual. Now we can further break that down. If it's a maxillary tooth, we can call it the palatal surface as well. Most of us call it the lingual because it's towards the tongue. If it's facing the cheek or the lip, it's called the facial surface. So the facial surface is also divided into the labial surface for the anterior tooth and the buccal surface for the posterior tooth. So the whole surface facing our lips and cheeks is called the facial surface. The facial surface is further broken down into the labial surface for the anterior and the buccal surface for the posterior. So I can have a facial surface of a posterior tooth, but I can't have a labial surface of a posterior tooth. I can have a facial surface of an anterior tooth, but I can't have a buccal surface of an anterior tooth. So facial is the entire arch facing the cheek or the lips, but if you're talking front teeth, anterior teeth, it's only the labial. If you're talking posterior teeth, it's only the buccal for lip and cheek. This is from the book. It's got everything you need to know about direction. Mesial is anything going towards the midline, which is towards the nose or your chin. Distal is away from the midline. Then you've got your facial here, anything towards the cheek and lip.
Excuse me, Misty. We
Yes.
can't hear you.
You can't hear me.
Oh, now I can.
Oh, okay. Can you hear me
Thank
better now?
Yes.
Okay, I put the microphone closer to my head. I'm talking with my hands and I am trying not to bang the microphone. So you've got your distal, which is going away from the midline, mesial going towards the midline. You've got your facial, anything going towards the lip and cheek, which is further divided into labial towards the lip and buccal. Then you will have the lingual, anything going towards the inside. And then when we're talking, look on this lower left here. Okay, the lower left first molar. We're talking about specific parts of the cusps. We've got the mesial towards the front, buccal cusp. Okay, so that's talking about this cusp versus the distal lingual cusp. The distal is towards the back and it's on the lingual surface. So each cusp has its own name depending on the location. So the surface of the tooth that is next to another tooth is called the proximal surface. The surface of a tooth that's next to another tooth is the proximal surface. There are two proximal surfaces. The mesial is closest to the midline and the distal faces away from the midline. The fifth surface of the posterior tooth is called the occlusal surface. An anterior tooth has a ridge. The occlusal surface is more flat. It's the table of a tooth. So the occlusal surfaces of the mandibular posterior teeth hit against the occlusal surfaces of the maxillary posterior teeth when the jaw closes. So you can see that this is an occlusal surface or a table unlike a maxillary or a mandibular incisor, which has that ridge. The anterior teeth have a surface called an incisal ridge. So the lingual surface of the tooth is divided into mesial, middle, and distal third. We're dividing the tooth up. We're trying to get very specific when we're talking locations. The proximal surface of the tooth, remember, is next to another tooth, and that's divided into facial, middle, and lingual thirds. So you're dividing the tooth up into thirds. At any of the proximal, facial, or lingual surfaces can then further be divided perpendicularly into incisal, middle, and cervical thirds. Don't freak out yet, folks. The posterior teeth has an incisal third, but it's called the occlusal third because posterior teeth don't have an incisal ridge. It has an occlusal table. So this is how the tooth is divided up. We're dividing every surface into thirds. So we've got, for the root of the tooth, we've got the apical third, the middle third, and the cervical third. For the crown of the tooth, we've got the incisal third, the middle third, and the cervical third. The front of the tooth, we've got the incisal, middle, cervical, incisal, middle, third, cervical, okay? And we've got the same thing going on here as well as here. You're dividing the tooth up into thirds. If it's closest to the incisal or the occlusal surface, it is the incisal or occlusal third. You've got the mesial third, the middle third, and the distal third. All right, so this is where your graph paper is going to come in handy when you're drawing your teeth. All right, so if you have an anomaly or a cavity that you're trying to describe the location of to the dentist or chart it, it's very important that you understand these thirds because it's going to be different if you've got incisal wear on the mesial incisal edge of tooth number, mesial incisal edge versus the distal incisal edge. The cervical third versus the occlusal third. Then we have something called line angles. Okay, now this again is how are we reading the map of a tooth? A line angle is formed at the junction of two surfaces, the mesial and incisal. Okay, two surfaces. Line angles are named according to the surfaces they join. All right, so you have the labial incisal, all right, two surfaces, the labial incisal, the lingual incisal line angle, the distal lingual line angle. So you can see that everything has two surfaces on it and they join. Linguo-incisal. Can you find the linguo-incisal line angle? Two surfaces joining. For the posterior teeth, it's the same thing. You've got two surfaces, the mesial occlusal versus incisal, and that's the only difference. It's a mesial, and instead of labio, it's a buccal, okay? Same surfaces, different names because you're talking an anterior versus a posterior tooth. Now, those are two surfaces. When three surfaces meet, it's called a point angle. Are you ready to shoot yourself right now? A point angle is three surfaces. Line angle is two. Point angle is three. Mesio-labial incisal. Mesio-lingual incisal. Okay, there's three different parts of the tooth coming together. Mesio, lingual, incisal, three parts. For the posterior tooth, again, it's three parts. Mesio-lingual occlusal, point angle. Mesio-buccal occlusal, point angle, three surfaces. So you're going to be seeing questions on line angle and point angle, and what you have to do when you have a question like this, the way I have to do it is close my eyes and try and visualize those angles. Do they meet or do they not meet? Because test questions will want to try and trick you up on, is this a point angle? And you're going to have to say yes if the 3 points meet, or no because it's impossible. Okay, you can't have a mesio-distal occlusal. Okay, those surfaces aren't going to meet. You can't have a mesio and a distal and occlusal point angle. We need to be very specific. So when the crowns are formed, they develop from 4 or more growth center called lobes. Okay, we need to know what lobes are. You're going to get more in depth with this with histology with Mrs. Heberly, but these lobes eventually fuse, but a line remains where the fusion of the lobes take place. And these are shallow grooves or lines that separate the primary parts of the tooth or root, and they're called developmental grooves. So developmental grooves are where the lobes join. This is showing you all the developmental lobes. So an incisor tooth is formed from 4 lobes. 1, 2, 3 form the facial or labial surface, and the 4th lobe is here. Look at this mandibular first molar. It's formed from how many lobes? 5. This is a maxillary first molar. And here's the cusp of Carabelli, the 5th lobe. This is a premolar tooth. 1, 2, 3, 4 lobes. Separating those lobes, you've got a little groove or an indentation, developmental grooves. Incisors, yeah.
I just have a quick question that on the molar, the C1 occlusal, yeah. So the lobe doesn't go with the pathway like 1, 2, 3, 4, 5. Let's go with 1, 2, 3, 5, 4. So how
1,
can we
2,
classify the lobe?
3, 4, 5. Well, they're just numbering. And this is number 1 is always the mesial portion of the tooth, for example. And then number 2 is the distal portion, and then they come back. So it all depends. I don't know how they do it.
Oh, okay. Yeah, I just
I'm not
confused
going to
that.
ask you what the 5th lobe is now, or what lobe number 2 is, unless I want number 2 to be labeled as the distobuccal lobe, because this is the distobuccal on D
Mhm.
versus 4 is the distobuccal on C.
Okay, so the number doesn't matter.
It
We
doesn't
just
matter.
do remember what lobe is.
You just need to know what the lobe means. Yes.
Okay, all right. Thank you very
Yeah,
much.
don't. Oh my, this is hard enough. The incisors, canines, and most premolars are developed from 3 facial lobes and 1 lingual lobe. This is what you got to know. 3 facial and 1 lingual. Second molars are developed from 4 lobes, 2 facial and 2 lingual. Those are your second molars, versus the first molars have 5 lobes. Okay, 5 lobes. 1, 2, 3, 4, 5. This is the mandibular first molar. 1, 2, 3, 4, 5 for the maxillary molar. So these are first molars, 5 lobes, second molars from 4 lobes. Most teeth are derived from 4 lobes, except for the first molars. So we're further dividing and learning the language, right? The cusp tips, those type of things. You've got something called a tubercle, which is a small elevation. It's not a cusp or anything, but it's a small elevation of enamel on some portions of the tooth. Okay. It doesn't always occur on the lingual surface, but it can occur on an area like the buccal or the occlusal surface. So it's an elevation. A tubercle is not a cusp, it's just an elevation. A fossa is an area of the tooth that is indented or concave. Okay, a fossa is indented or concave. Remember our fossa in our throat? That's the hole in a throat. It's concave. The fossa is named for their location. In anterior teeth, the fossa is between the marginal ridges. I don't know what a marginal ridge is. It's okay. And the incisal to the cingulum. I don't know what the cingulum is. It's okay. Okay, cingula is plural for cingulum. When a pinpoint hole is evident within a fossa or anywhere on the tooth, that depression is called a pit. So you've got a fossa, which is a large depression, but if it's a pinpoint depression, it's called a pit.
Thank you.
You're welcome. Pits usually occur along the developmental groove or in a fossa. So the pits, again, are named according to their location. If you need to chart a suspicious area and it's on the mesial pit versus the distal pit, it's going to make a big difference. You can't just say it's on the occlusal surface. You have to be very, very specific. So a tubercle is a small elevation versus a cusp is a mound on the crown portion of the tooth that makes up a major division of its occlusal or incisal surfaces. Cusps are found on all posterior teeth. So the difference between a tubercle and a cusp is size. A cusp makes up a major portion of the occlusal or incisal surface versus a tubercle is a small elevation. Then we have a ridge. A ridge is an elevated portion of the tooth that runs in a line. Think about a mountain ridge. A ridge, okay, is also named for their location. That's what sort of makes oral anatomy easy, because if you can take the word apart, you can identify the location of what we're talking about. All cusps have 4 ridges. You've got a buccal or a labial, okay, or a facial, okay, a lingual towards the tongue, a mesial towards the front of the mouth, and distal towards the back of the tooth. So the cusp is even divided into parts. Now for the anterior area, okay, we've got what we call our marginal ridges, and they are the rounded borders of enamel forming the mesial and distal shoulders of the occlusal surfaces of the posterior teeth, or mesial and distal shoulders of the lingual surfaces of the teeth. So all teeth have marginal ridges. They just look differently. Okay, so this is an anterior, it's a picture of an anterior central incisor. Okay, so this is the mesial, and this is the distal, lingual, mesial, lingual. All right, and the marginal ridge is here. It's the rounded border of enamel forming the mesial or distal shoulder. You have a concavity, which is shallower than a fossa. When you have a concavity, a little shallow depression or carved out depression, you usually have a convexity where it's bulging out. So a concavity and a convexity, is it scooping in or bulging out? So you've got your distal marginal ridge, your mesial marginal ridge, you've got tubercles, you've got a fossa, shallow depression, or concavity. And for anterior teeth, you have 2 developmental grooves on the labial surface that separate the 3 lobes. Remember, the anterior teeth were formed from 3 facial lobes and 1 lingual lobe. Oops, excuse me, and 1 lingual lobe. And the 3 facial lobes, okay, have a slight groove going in between them. One lobe, 2 lobe, 3 lobe. Okay, and there's a slight depression there. The 4th developmental lobe of an anterior tooth has something called a cingulum, and that cingulum occurs on the lingual surface of the crown. And this is the cingulum here. This is the fossa or the concavity, the shovel portion of the tooth. This is the cingulum, the 4th lobe. It makes up the bulk of the cervical third of the lingual surface of the tooth.
So I have a question, Ms. D. So for fossa, are you saying that they are only found in anterior?
No,
teeth?
any tooth can have a fossa. This is just the fossa of an anterior tooth.
Okay.
The scooped out portion. So it's like reading a map. If, you know, posterior teeth can have fossa as well, any scooped out portion. The developmental line that separates the 4th lobe from the labial lobes is called the lingual groove. Sometimes you see a lingual groove and you don't see it. The lingual fossa separates the lingual lobe from the other 3 lobes, and the lingual groove may be a single groove or maybe several grooves interrupted by a tubercle. This is a lot of information, my friends. Just try and have it absorb. When you are going through the textbook, it will show you pictures. So when you're looking at the pictures again, you'll have a little bit more framework in mind. Okay, the posterior teeth, the most obvious landmarks of the posterior teeth are the cusps. The number of cusps vary according to the tooth. Remember, the first molars have 5 cusps and the second molars have 4 cusps. Ridges are slight elevations. Triangular ridges are the main ridges of each cusp that run from the tip of the cusp to the central portion of the occlusal surface. So what we're doing is we're learning the terminology. You've got a fossa here, slight depression. You have a ridge, an elevation of a cusp. This is the cusp ridge here. But this is the mesial of a tooth. This is the mesial occlusal cusp ridge of such and such a tooth. Then this will be the distal cusp ridge of whatever tooth this is. So you've got something going towards the mesial, something going towards the distal, just as this cusp will have a mesial cusp ridge and a distal cusp ridge. You've got a slight depression, which is a fossa, elevation here, which is another ridge, and then you've got your groove patterns. Makes you want to cry, doesn't it? We are going to be going into this with each class type of tooth, so it will be repeated and repeated and repeated until you get it. Now, posterior teeth have something called, some of them have a transverse ridge. So if you've got two triangular ridges, okay, one on the buccal and one on the lingual, and it crosses the occlusal, okay, it's called a transverse ridge. This is a premolar. Transverse ridge. It goes from the buccal, and then it's another one on the lingual. Not all of them meet. This doesn't have a transverse ridge. You've got a ridge here, you've got a ridge here, you've got a ridge here. This is called an oblique ridge. It's not a transverse ridge. It goes from the buccal to the lingual, but it goes to the side. Distobuccal to mesiolingual. That's the transverse versus the oblique. Transverse is straight from the buccal to the lingual. A lot of information.
Miss D, I just have a quick question that do all teeth have the cingulum?
No, all teeth do not have the cingulum. Anterior teeth have cingulum, where the fourth cusp is, the fourth
Just the
developmental
anterior
lobe.
teeth. So basically, just the anterior teeth have the cingulum. Is that correct?
Exactly.
Okay.
Okay. Incisors and canines.
All right. Thank you very much.
Miss
Okay.
D, I have a quick question too. Going back a few slides, you were talking about, I can't even remember, was it the triangular ridges? I think it was that one, yes. And you talked about them as the mesial. Did you mean the mesial within the tooth?
Within the tooth. This ridge, this is a mountain ridge, this cusp tip here.
Okay.
So this is the mesiobuccal cusp.
Okay.
And then you've got the mountain peak, which is the mesio cusp ridge, mesiobuccal cusp ridge, and the distobuccal cusp ridge, because it's going towards the distal. This is going towards the mesial.
So
this is the mesial cusp ridge of the distobuccal cusp.
Okay.
And the distal cusp ridge of the distal buccal cusp.
Okay. So always mesial, meaning going towards
the center
of the face.
Mm-hmm.
Okay. Okay. Just wanted to make sure it wasn't going towards the more central part of that tooth, because I just got confused there. Sorry, but thank you.
Yeah. It's a pain. So this is facing the mesial portion of the face. This is facing the distal portion.
Okay, I got it. Thank you.
Okay. So each part has a specific name to it.
Miss D, so we're reading that part as like we're separating the tooth into loops and then looking at if it's distal or mesial. Right?
Yep. This is the mesial of this cusp ridge, and this is the distal of the mesiobuccal cusp.
All right. Thank you.
So this whole thing is the mesiobuccal cusp. And then you've got parts within the parts. Okay. Any other questions? You guys have to come back. Please come back. Let's take a short break. Let's come back in 5 minutes. Is that okay?
Yes, thank you so much. We need this break.
I do too. All right, I'm going to stop the recording.
Okay, thanks.